Good morning, dear friends. The new regulation for medical education, which was introduced in 2019, has introduced a new module called AETCOM module, AETCOM, that is Attitude, Ethics and Communication model for the training of undergraduate medical students all over India. There has been a felt need that apart from proper training in clinical medicine, there should be proper training in developing the character of a doctor, the attitude of a doctor, the ethical values of a doctor, as well as the behavioral aspects of a doctor, which are extremely important in modern context. It's with this intention that this AETCOM module has been introduced. So essentially, AETCOM is a module which handles three aspects. Number one is attitude, number two is ethics, and number three is communication skills of a doctor. What is meant by attitude? Attitude is the way in which a person reacts or responds, even in most adverse situations, to bring about the best possible output available at that point of time. And ethics is a set of principles or guiding principles which are necessary for forward travel in any profession in such a way that your act can be maximally beneficial to everybody involved in that particular situation. And behavior is the way in which you conduct yourself in your interaction with significant others you have to interact with as part of your profession. So the AETCOM module for undergraduate medical students contain different modules, especially in the first professional MBBS year. There are 5 different modules which are supposed to be discussed. The first one is, what is it to be a doctor? Second one is, what is it to be a patient? Third is doctor-patient relationship. Fourth one is communication skills, and fifth one is cadaver as the first teacher. So we'll be discussing about the first of these topics in this video. What is it to be a doctor? What is the role of a doctor in modern society? That is a fundamental thing which is discussed or which is supposed to be imparted to the undergraduate medical student as part of this training. So here again, the fundamental responsibilities and duties of a doctor include, number one, a doctor should be a lifelong learner. He should be able to learn, assimilate and understand information. He should be able to keep himself abreast with the changing information which is available in medical sector. He should be continuously aware of the changing pattern of research which is there in medical sector. And he should be a good teacher also. He should be able to impart this information in understandable fashion to the layman, to the public person. He should be a person who is a clinician, who is able to treat illnesses. At the same time, he should be a person who is able to give enough focus to prevention of diseases and promote positive health. And he should also be a researcher, and he should also be a critical thinker. You should be able to generate new information in research, new treatment modalities, new interventional methods as part of treatment in illnesses. And he should also be able to do proper research following the ethical and technical guidelines of research and come forward with new information. And he should also be a critical thinker. Just because a particular research paper is being published, he should not ingest or assimilate that information just like that. He should be able to compare that information with already available information as well as his clinical experience, and then only assimilate the necessary information. He should be able to critically evaluate any piece of information which is available to him. So in first professional MBBS course, this training, what is it to be a doctor? It is supposed to be conducted in 7 hours time. The first hour is an exploratory session which is supposed to be a didactic or an interactive session running to 1 hour, in which the trainer or the teacher will be interacting with the students about their concept of what is meant by a doctor and clarifying certain fundamental principles, especially the 7 fundamental roles of a basic doctor as envisaged by the National Medical Commission, Government of India. The next session will be a facilitated panel discussion running to 2 hours. And in this session, doctors belonging to different generations are supposed to come together in a panel and share their experiences of how medical practice has evolved over the decades. Probably a doctor who has retired from active practice but is still observant and aware of the new gen changes in medical practice can be a first person. A senior consultant who is still continuing his practice but towards the last phase of his professional career can be a second person. The third person can be a person who is in academic medical training sector in a very important role as a professor or a teacher, and he is very actively involved in the present aspect of medical training. The next can be a young person who is into academic clinical practice or into working in government or private sector, who is a young person who is willing to take up challenges. And the last person can be a medical student or an intern or a postgraduate trainee who is coming to terms with the realities of medical practice but is aware of the new generation challenges which are posed in front of the profession. So these 5 generation of doctors, or 5 doctors belong to 5 different phases of their clinical career, can come forward. They'll share their wisdom and experiential awareness to the students, following which the students can of course pose their questions, their queries, and discuss with these panel members who would be clearing the doubts raised by the students, thereby giving the students a clear-cut idea regarding what is going to be the life of a doctor, the life and practice of a doctor. The third phase of the training is again a self-directed learning module running to 2 hours. Based on the information obtained from the exploratory session and the facilitated panel discussion, the teacher can divide the students into different groups of around 10 students each and give them important thinking points about which they will brainstorm, come forward with ideas, and finally at the end of that session these ideas can be presented in the whole class also. One person from each of these groups can consolidate the ideas which have been generated from the brainstorm session in each group and present this awareness in front of the entire batch, as a result of which discussion about these awareness and clarification of ideas can be made possible. This is followed by a 4th phase of that training, that's a 2-hour hospital visit session in which the students are supposed to shadow a practicing doctor. They can visit the hospital which is attached to their medical school. They can observe the functioning of a doctor. What is the doctor doing after coming to the hospital? How he is going to the wards, how he is interacting with patients, how he is explaining about the illness to the patients as well as the caretakers, and what are the other important aspects involved in the practice of medicine. So this is an opportunity to observe a doctor in action. Here the student is not interacting with the patients or talking to the patients at all. He is just observing what the doctor is doing to get a first-hand idea about what the life of doctor is likely to be at the hospital. And finally, the last phase is a 1-hour closure session where all the awareness and all the ideas which have been generated over the last 4 phases, they are consolidated, they are presented by different students, different groups, and finally the trainer will consolidate the available information and impart the take-home messages for the student, which they are supposed to take home and imbibe and put into practice for the rest of their life. So here, this is an opportunity for medical teachers to introduce students to different disciplines of humanity also, because one big problem in medical practice is that medical practice is restricted to just scientific discourse. Humanity is totally ignored. No, here we can give homework assignments for the students. We can ask students to watch certain movies which could be of significance to medical practice, like say Patch Adams, or different movies in different languages. So many of them are available. And again, books pertaining to medical practice, the life of a doctor, like so many books are available, like Viktor Frankl's Man's Search for Meaning, or When Breath Becomes Air by Paul Kalanithi. So many books are available. So books can be given. The news which is coming in mainstream media about doctors can be given to another group. The messages which are spreading in social media about the life and practice of a doctors can be given to another group for analysis. And all these homework assignments can also be put to good use. And in the final closure session, the way in which literature, media, cinema, and social media is portraying medical profession can be discussed in great detail, and the sort of interventions which medical professionals will have to make in the media to clear misconceptions among the public about medical profession can also be discussed. In this way, the social awareness of medical students about the realities of life can be clearly communicated, and probably students who are trained in this way may be more socially aware of the changes happening in the society, and they'll be able to communicate better with the public in the long run once they become consultants in their respective fields. Thank you.